Hello, everyone. So, a very good evening to all of you. I'm very much happy and very excited to introduce you to our next speaker for today's session. We have Dr. Ammar Suhail sir with us for this session on musculoskeletal physiotherapy. Since long time, we had been wondering about like musculoskeletal physiotherapy is just orthopedic, those bones, muscles, and you just treat them and things are sorted. But it's something apart from that, something out of the box. So we need to see what is the new narrative that has we have been establishing from past couple of years, and what new things have come into action in the past couple of days. So this thing, Dr. Ammar Suhail sir will be introducing with us. So sir is from lovely professional university, and he is acting as an assistant professor there with a number of national and international, research papers which he have published. So I would like to invite Sir. Sir, kindly join the session, and here we go.
Okay, I'm audible, I'm visible both.
Yes, sir, perfectly audible.
Okay. Uh, okay, fine. Okay, good evening, Nitin. Good evening, everyone. I hope I am visible. Screen is visible and I am also visible. So let me
Yes, sir.
just start my presentation. I hope it loads. We'll start in just 2 minutes.
Yes, sure, sir.
Share my screen. Is this visible?
Yes, it's perfectly visible, sir.
It's full screen, right?
It's just the normal mode, not the full screen mode right now. So I believe we
Okay,
just need to.
let's see now.
Yeah, screen is there, sir. Almost similar. I mean, not full screen, but
Okay, again, it's the same.
yes.
It's not going full screen. Okay. I think now it's visible full screen.
Yes, sir. Now it's perfectly visible. So let's start.
Okay, then let's start it. Okay, I think lots of people are there, so I can see your answers on YouTube live.
Yeah.
So it will, yes, so I've just put my phone on there. So if you want to ask something, you can put it there, or if I ask something, you can put it answer there, right? So both the ways. Okay, so I'll go as slow as possible. Try to explain whatever is there on the presentation. There is not much written there. I'll be speaking much more than that is written there. Okay,
That'll be great.
so my name is Ammar Sohail, as Nitin has introduced. Okay, I am a musculoskeletal physiotherapist. Um, that basically means we see joints, we see muscles, we see bone problems. Not just that, we see nowadays beyond that balance issues, fall prevention. So we have moved a little more ahead. So that's why the topic is changing narrative. Plus, I'm not. Uh, I did my bachelor's in 2008. So from then till now, a lot of things have changed. So basically, what is there in the today's presentation is just my understanding of how I have been practicing. So it's all hands on what I have done with my patients over the years, how I have evolved. So I've been now practicing almost now 6 years. So over this period of 6 years, how many the way I have approached the patients, how they have changed, is what we are going to talk about. Now, it may be different from what you have been practicing because, of course, practice varies from individual to individual. So this is my opinion in the light of the evidence. What is what we are going to talk about? Now, the first slide, the image is selected because of a purpose. Okay, this basically shows that a journey. Okay, so we have to travel from one door to the other or travel through a lot of things throughout our life, and patients do come and go and teach us a lot of things. Okay, so this is the basic overview why I took this topic when Nitin invited me to talk about why I wanted to talk about this topic. So it will be very basic. You can see yourself in the presentation, you can see yourself practicing because I will be going very what you can say case based, so it will be easy for you. Okay, so any question in the in the midst of the session, you can please let us know. Okay, so this is the background of it. Okay, why this topic is chosen and why this is there. Now every slide will have a purpose, and we'll keep on going through that one by one. So this is the place where I teach. I hope this is visible to everyone. This is Lovely Professional University. This is where I've been working, seeing patients, teaching, doing research, a lot of things. It's a wonderful place. More than that, it's a very beautiful place to be there. You all should visit once whenever the corona is gone. So this is the place where all it all started. Before this, I worked in Apollo, uh, Delhi, Sarita Vihar branch. That's where the clinical experience started, and then moved on to this place. Okay, so this is the beginning. Now, what we are going to discuss, and at the end of the presentation, what basically you are going to uh, grasp. So, first of all, we'll learn to understand the common way to assess our patient. Right? We all are there to help our patients. I think everyone agrees on that. ठीक है, हर फिजियो का बेसिक काम ये है कि हम अपने पेशेंट को सही से देखें, है ना? We provide optimal care to him. Every doctor's role is like that, right? Not just physios, everyone who's treating patient. हमारा सबसे पहला role क्या है? That we give utmost importance to our patient and we treat them with utmost care and properly. Okay, that's our first primary goal, and that is what our profession is based on. Everything comes on hand on, like research supports that. Okay, academic supports that, but the basic role is to see patients. Okay, so if you want all those budding physios who are here, please remember, if you want to learn something, start seeing patients. Okay, reflect on your patient, how do they do. So this is what we are going to see. Second is, I'll just introduce you to a term known as evidence based care. What is evidence based practice? बहुत ज़्यादा quote unquote it's abused, it's overused, बहुत सारी कहानियां हैं इसके बारे में. Then finally, clinical reasoning. And I, over the past few years, I have understood that this is the thing which is missing among Indian physios. We see patients, we see a lot of patients, honestly. Even an average, uh, or you can say even in an average hospital, an intern see a lot of variety. Okay, let's not talk about multi-speciality. Even in a small clinic, we see a lot of variety. This is the richness of our patient, of our country. And we see a lot of variety, a lot of cases, right? So, uh, where are we lacking actually? Where is the problem arising? हम क्यों care नहीं कर पा रहे हैं? That is the answer of that is the answer to that is clinical reasoning. ठीक है, so if you're following me, then we'll go ahead. These are the three objectives. If at the end of the presentation अगर आपके ये तीन objectives इनके answer आपको नहीं मिलते हैं, that means either I have not communicated properly or you have not understood it. Either way of around, right? So let's start with the case. This is not my patient. This is another guy where I work. Patient उनको था. Uh, I have just removed the name because of privacy. So this is Mrs. Z. Okay. She's 76-year-old female who lives independently in her own home. So she's an independent lady living in her own home. She sits in the emergency department. So she is visited in a multi-speciality hospital. Uh, जहाँ पे she tells that she had a fall. And because of fall, there's a slight bruise on the head, which normally happens. She's anxious and apprehensive. And after the first aid, because it's a case of fall, it's a case of balance problem, the surgeon or the attending staff sends her to the physiotherapy. Normal routine practice, what happens? तो उनको physiotherapy department भेज देंगे for further evaluation. Now, when she comes to you, of course, she will say a lot of things. You will ask a lot of things to her. And what are the first things she says to you is she has had similar episode of fall last month. Okay, and she also reports that she takes medicine to help her sleep, so her sleep is not good, and her mood swings are there, which she takes medications for. Okay, so I hope everyone understands this case. This is a basic, simple scenario which every one of us face or may face. Okay, simple case है, एक फॉल का पेशेंट है, आपके पास आया है ना, अब आपने क्या करना है? So the question is, what will be your approach towards this patient? So you can type in chat. I'll just wait for 10 seconds, maybe 20 seconds. Anyone, your any approach, no approach is wrong. It's just that one approach is more scientific or like that. Anybody wants to share their opinion before I share my opinion about it? Okay, so some answers are coming. Yash has answered. Thank you, Yash. Anyone else wants to add on to Yash point? Cold therapy. That's a good answer, Srishti. Yes, anyone else want to add on? There are so many people here, I can see. So PNF, right? Cold therapy. That's good. Okay. Ayushi says PNF. Okay. Srishti says cold. Anyone else? Okay, medical history. Purnima wants to take medical history. सबको केस बनना है. ये केस है, आप क्या करो? यू आर इन एन ओपीडी बेसिस और आपके घर पे पेशेंट आया है और आप हॉस्पिटल में देख रहे हो. ठीक है, अगर आप इमरजेंसी डिपार्टमेंट हटाना चाहो, आप सोच सकते हो क्या है ना, बैलेंस. सो ठीक है, दिस इज द क्वेश्चन, व्हाट विल बी योर अप्रोच टुवर्ड्स दिस पेशेंट? क्या करना चाहेंगे आप इन पेशेंट? एक पास मेडिकल हिस्ट्री. ठीक है, तो हम आई थिंक सबको एक आइडिया हो गया बेसिक के. ठीक है, वाइडली. ओके, तो बहुत सारे आंसर्स आ गए हमारे पास. अच्छी बात. तो इन आंसर्स का हम वो बनाते हैं, कुछ सेंसिबल चीजें बनाते हैं. तो हम क्या करेंगे? ठीक है, बहुत बार पढ़ा है. वी हैव स्टडीड दिस इन मैगी अ लॉट ऑफ टाइम्स. द इशू इज व्हेन द सिनेरियो इज इन फ्रंट ऑफ अस, राइट? We don't follow the sequence, or let us not say it's sequence, we don't follow a systematic approach. I'm not saying you always have to follow a systematic approach, but it is always good to go stepwise. Reason, because what, the patient will also be more convinced, you will also be very confident, right? So मेरा जो aim था case to show you the case was this only. Whenever we see patients, you know, majority of us think of the treatment. We think of ourselves, right? We never think of the patient. So we have to look at the problem from the eyes of the patient. She is here, okay, I'm not there to give all those things. So never think of treatment on the first hand. Always look for what the patient is having. Okay, I hope the first point is clear. What mistakes we are making. So this is the primary mistake most of the physios make. Patient आया, immediately we think of चलो ये treatment दे देता है. Or I had done a workshop chalo, I'll give this technique to the patient. But ideally, okay, we should be following all these steps. Okay, is it fine? I think this is the first and the foremost thing that we want to do. So this is the pattern that you need to do. Okay, पर इसको गंदा कर दिया. But I hope this point is across to every member, right? Now, this patient, right? I will do an examination. I'll do an evaluation, right? I'll try to reach a diagnosis. I'll try to tell her the prognosis. I'll try to tell her the outcome. I'll try to use some outcome measures. So maybe I'll be able to tell her better. Then finally is the intervention. So patient, है ना, कि कुछ लोगों ने बोला भी था soap approach. So yes, we have to first assess this patient. Then only we can decide on what we can give to this patient. Okay. I hope that makes sense to everyone, and we can go ahead. Now, what is EBP? Now the question is, okay, I'll follow an approach, okay, and I'll assess this patient. But now, how and what I'm going to do with this patient? So there's a term known as evidence-based practice. Okay, what does this basically means is a physio, okay, or a healthcare provider who is attending a patient, so you should use recent scientific evidence, okay, along with the patient's preferences, right? What does she want? It's the patient who has come to us. What does she want? What are her beliefs? What is her behavior? How is where she is living, right? And then finally, my experience. What is my experience with falls, right? How I have been treating falls. So this is what overall is known as evidence-based practice. So don't do things which are not supported by research. Reason is physiotherapy is a science. Okay, physiotherapy is a scientific profession. Okay, we are not a philosophical profession. We are a scientific profession where we have science which tells us the muscle anatomy, the physiology, how it works, the biomechanics, okay, and the pain education, the pain assessment. So it's a scientific profession. It's not anything. कोई भी आके बोलेगा आप ऐसे कर लो. It's not like that, right? It's a scientific. हर किसी को ये चीज ध्यान रखनी है. We are a scientific profession. We follow science. जैसे physics के law हैं, chemistry's law are there. Similarly, we have to follow scientific evidence. ठीक है? और कोरोना के टाइम में, okay, the COVID is the best time to teach you about EBP because you are seeing around us evidence being practiced, right? Before plasma was given, now it is not given. Why? No evidence. Before something was remdesivir was used, now it is not used. Why? The evidence is not there. So we are seeing in this COVID times that the evidence around us is being used. We also have to use the same concepts. We also have to focus on the same thing. ठीक है, आप देख रहे हो है ना, वैक्सीन आई कहाँ से आई? बिकॉज ऑफ अ साइंटिफिक evidence. Okay, now we are all very confident that the vaccine will prevent infection. Why? Because there is scientific evidence behind it. So similarly, when you're assessing, when you're taking history, right? When you're doing a test on a patient, when you're prescribing an X-ray to a patient, do he really needs it? Is there any scientific evidence behind it? Does the patient requires it? Patient values, and in my experience, is it required? Is what I'm going to take into consideration. So please see around you, है ना, मुझे नहीं लगता इससे अच्छा कोई टाइम होगा एविडेंस को समझने के लिए because everywhere around us evidence is being going on. It's out there. Daily ICMR is saying something, mask, double mask. For everything they're bringing out the evidence. Okay. So similarly in physiotherapy, if you are not following evidence, please start following it because if you're not following it, you're doing disservice to a patient. Maybe you're using an 1947 technique which should not be used. So update yourself, learn how to use EBP. This is not a lecture on EBP, so I will not be able to go into in depth of the EBP, but I'll just wanted to give you an overview of what EBP is. Okay, so we have to follow a systematic approach. Everyone agrees to that? Yes. Second is we have to follow evidence-based practice, right? So our patient had a fall. I'm following a systematic approach, and now I'm going to use EBP in my patient. Is it fine? I hope this is clear up to here, right? Okay. Now, what is examination? ठीक है, हमने पहला क्वेश्चन आंसर कर दिया. First question was what approach. Second question was I'll be using decent evidence. Third question is what is examination? Sir, you're talking about examination, evaluation, examination, evaluation. What is examination? So what is examination is it's a combination of, okay, this is again to me this classification. It's the history, subjective examination, it's objective examination, and it's diagnostic test. Let's go one by one into it. First and the foremost and the most important is history, his story. So it is his or her story. Please try to listen to the patient with utmost care, utmost attention. Okay, listen to them as attentively as possible, because James Syriacs, the father of manual therapy, father of manual medicine, says if you listen to the patient 90% of the time, your diagnosis is going to be correct. If you don't listen to the patient 90% of the time, your diagnosis is going to be wrong. These are his words. Okay, so remember, again, I'm emphasizing this thing. Whenever you're listening to the patient, listen attentively. Try to listen to her problems, his problems. It is his story. Please let him say. Okay, don't interrupt him. Maybe if he's going very off the topic, you may guide him. Okay, but don't put words into his mouth. For एग्जाम्पल पेशेंट आया, आपको पेन है? हाँ मुझे पेन है. उठने बैठने में पेन होता होगा. You are guiding the patient to answers. You're putting words in his mouth. We should not do that. Let him tell whether there is pain in sitting on getting up or not. We are assuming and we are putting words in his mouth, which should not be there. So it is very, very, very important that we allow the patient to tell his or her story. Every patient has a story. Okay, even these mummies behind in the Egyptian pyramids also have stories. They also tell stories, right? So everyone has a story to tell. We have to listen the story. Now, as I said, scientific evidence. कि तो मैं बोल रहा हूँ physicians interrupt करते हैं. Do I have a scientific evidence for that? Yes, I have a scientific evidence for that. There was a paper published in JAMA, Journal of American Medical Association, ठीक है, जिसमें उन्होंने बताया था कि doctors, including physios, occupational therapists, we interrupt our patients after 18 to 23 seconds of speaking. So once the patient speaks, okay, he or she speaks, we interrupt them within 18 to 23 seconds. So this is what I wanted to convey. Okay, that when you're taking history, please don't interrupt the patient. Okay, please don't uh, tell them which are not present. Please try to listen as attentively as possible. Okay, and don't interrupt. That's the first thing. Now, in history, I think every one of us knows. I don't need to go into detail. What we take, chief right. We are taking past history, present history, right. So I think everyone knows that. So I will not go into detail of that. It will get a little boring. So we all know what history to take. We have to take every history possible. You know? We have to take medical history, we have to take drug history, we have to take vitals, everything we have to document and as accurate as possible. Okay, so within this history, okay, within this history is you will get a lot of clues. Okay, so I hope this point is also clear to everyone, right? Now, Akshay has a question and I'll answer that. If you're working in another state, you may face language barrier. It is very true. If you're working in another state, you face language barriers. I would recommend that you start understanding the language. Like, see, I don't know Punjabi, honestly, but I work in a Punjabi state where people speak Punjabi. So over the years, I have understood. I try to understand. I cannot speak it as fluently as them, but what they are saying is what I try to understand. I'll give you an example for this. In Karnataka, all universities have a compulsory course of Kannada because they want their physios to at least have a little bit fluency of Kannada. Because if the patient is speaking that, you have to interpret that. Okay, this is a live example. You can see the curriculum, you can see the syllabus there. Yeah, it is there. Okay, the language, the course is there. So this is the reason. This is your answer to your question. Try to learn that language. There is no other way of doing that because if you don't do that, the connection will not be there with the patient. You can understand that. Okay, that's a very important thing. I have a lot of interaction with students at Lovely Professional University how to understand the patient. Right, so it's possible. It's not like it's not possible. Okay, so this is one take home slide for every one of you. Okay, how to remember that we have to listen to the patient. ठीक है, बहुत simple है. It's just an analogy that railway signs can tell you a lot about essential ingredients of clinical anatomy. Attention, pay attention, be there. So as you're crossing the railway line, you're very attentive. कोई गाड़ी नहीं आ जाए ना, कोई train cross ना कर दे. Stop, don't talk. Okay, look in the eyes. Be confident. By your confidence only, you will build a very good rapport. And listen. Listen to the patient. Okay, and this is what is written here. Stop, look, listen before crossing the railway tracks. Same way, stop, listen, look. So all those things you have to do while taking the right. Okay, I think this point is also clear to everyone. So this is the approach. Next comes the subjective and the objective examination. Right now, a lot of controversy here, and I'll try to address those controversy here. Uh, okay, my voice will get better. I think little bit fluctuation in between maybe. Okay, so subjective and objective examination. Now, all of us know what is subjective examination. All of us know what is an objective examination. I hope if you don't know, I'll just clarify. Subjective is when we are just observing our patients. We are looking at the patients. We are looking at their body style. We are looking at their behavior. We are looking at their expressions. Right? We are looking at a lot of things. That is subjective. We are looking at the color of the skin. We are looking at the nails. We are looking at the eyes. We are looking at the color of the tongue, lips. Sometimes, okay, any confusion. Basically, we are not touching the patient. We are just observing the patient. We are just looking at overall the patient. Objective is when we get our hands onto the patient, right? When we touch the patient, right? When we ask them to move, to do movements, okay, to do any special test, to do any kind of range of motion assessment, to do any kind of MMT, to go to any kind of strength testing or any kind of isometric testing. So objective is when you're touching your patient, right? When you're handling your patient. So my take home message here is subjective. After doing the subjective, before doing the objective examination, please take the consent of the patient. It's a very simple thing, right? But we forget. It's very essential because physiotherapy is a profession where we put hands onto the patient, right? Some people don't feel comfortable unless and until you have made them comfortable. So you might not be able to get real results out your examination because the patient is apprehensive. Take consent, take them into your good confidence, and then do an objective examination. This is true for medical legal purposes also. Nowadays, every patient is aware, right? We are practicing in 21st century. In okay, so these things has to be taken very much care of, and there are a lot of issues nowadays. So I always advise my students and fellow physios not to avoid this consent taking. Just verbal consent, okay? Written consent is not possible in Indian context. नहीं लेते हैं, but if you go abroad, people take that written consent also. So try to be as sure as possible. Okay? So approach clear हो रहा है सबको? History ली हमने. जिससे हमें बहुत सारी चीजें पता चली. We came to know about a lot of things from the history, right? Then we confirm that history from subjective and objective examination. We just match it, not confirming. We matched. Just a minute. Okay, my laptop charge. Okay, just got it fixed. Okay, so I think this is clear. Some questions are coming. I'll come to those questions just in a moment. यहाँ तक anybody has any questions up till here? I hope the approach is getting clear. So this is a simple approach. सबको पता है. What I'm just trying to do is I'm just trying to put it into into sequence. That's the only thing I've done. Right now, there was a point here by Rijul and then by one more person. So I'll just try to answer that first when we examine the patient, right? So, Vijay, the point is, do I think that observation जो हमें सिखाया गया है and the things we observe, like there's this up slip, there's a down slip, the deformities, the problems in the patient does not have a scientific basis. So yes, you can observe them, but are they contributing to the patient's pain is doubt, right? So please make sure when you're assessing whether your findings are correlating with your patient or not. So that may or may not be. Uh, okay, so that may not be sufficient sometimes. I think that answers your question. Do this question, I'll answer in a moment. Okay, so I think we all have done up till here. I think the points are clear. Now comes uh, finally diagnostic test. Now, first of all, I want to tell you this that we don't need to do a diagnostic test before. I have seen a lot of people when the patient comes in, see the diagnostic test कर देते हैं. That makes no sense. Okay, so immediately the patient came and हम अभी कर देते हैं diagnostic test. ऐसे नहीं करना है. We have to again follow the systematic pattern. We have to go through history. We have to go through subjective examination. Then only we need to come to the diagnostic test. Otherwise, the diagnostic test will not make any sense. Okay, so we will not get any sense to a diagnostic test. Let's go through problems with test. Okay, first of all, we need to understand that we are very humans are very we have high variations amongst. Okay, so I think you all are anatomy enthusiasts, so you can all go through this paper, or I'll share it with you all. The paper name is Thoughts on Human Variations, written by one of the best anatomists, Ronald, emeritus professor of anatomy in Iowa State. So he says that variability is the law of life, and so I have written it as a great read on human variation. So जब भी आप patients देख रहे हो और आप test कर रहे हो और आप X-rays देख रहे हो, ठीक है, this will come with experience, right? But try to understand that not every fault visible on X-rays and spatial test is a problem. Some things are normal human variations, right? I'll give you an example. Plantaris muscle is there, which is highly variable in all of us. In some of us, even it is not there itself. It is totally absent. In 30% of the population, it's not there. So our body is highly variable. So when you're seeing an X-ray or an MRI or a spatial test, try to understand what you're seeing is not always a problem. So don't label everything as a problem. Try to correlate it with your patient. Right? I hope this I'll just go a little fast. And okay, I'll come back to this point in a moment. Okay. Now a few questions I'll try to answer first. If you have a patient with low back pain and he's not comfortable to get it diagnosed, what can be done? Okay, I'll come to that question. Now, there's a big problem with MRI, especially in musculoskeletal conditions, and I'll try to highlight that here. Okay. This was I have made this. These are just images for Instagram posting. This basically talks about uh, a paper. So I'm just trying to emphasizing MRI और X-rays और diagnostic test जो है उसको हमने caution के साथ use करना है. We have to use it with very uh, utmost caution. We should not randomly scan every of our patients. So there was a study, and there are so many studies done on back pain patients, and they have shown, right? They have shown that most of the lumbar imaging findings are common in patients without back pain. So if you do your MRI scan, if I do my MRI scan, we all will have some amount of deformity, or not deformity, some amount of abnormality or age related changes. So there is this study says that there is no correlation between imaging and symptoms. ठीक है. So what, please don't be afraid of अरे इनके MRI पे तो bulge है अब हम कुछ नहीं कर सकते. It's not like that. Try to see the condition of the patient. Don't try to see the scan. Okay. Patients will always tell you हमने MRI कराया था पूरी spine खराब है. ऐसा नहीं है. We all can rehabilitate our patients to the best. So always remember, the findings on an MRI is not the final verdict. Yes, maybe for a surgeon, but not for us. Okay. And clinical decision making पे MRI imaging does not make any impact. ठीक है. So please remember this thing, especially in case of back pain. I think because we see a lot of back pain, I've just put one example here of a diagnostic test. Okay. So X-ray हो गया, MRI हो गया, every of these tests, diagnostic tests which you're using, right, ultrasound, all those tests, please try to understand that they have a very poor correlation between findings and symptoms. I hope this point is clear with everyone. Now, why this is so is because we are highly variable. One reason, and second thing is we all have some amount of changes with age. So please don't go on just MRI and say this patient is having this patient is having that. We are physical therapists, physiotherapists. We do hands-on examination. We have to see the physical condition of the patient before commenting upon the findings. Is that fine? My voice is clear to, or just him, or to everyone it is not clear? ठीक है, this point is clear. Should we go ahead? I think everyone is bored. I think this ठीक है. So diagnostic test क्या है पहले तो ये याद रखना है. ठीक है. हम there are X-rays, there are MRI, there are ultrasound possible, then there are uh, spatial tests possible. So whenever you're using them, please try to make yourself understand that they always are not correct. And you all आप सबने पढ़ा होगा हर रिपोर्ट के नीचे लिखा भी होता है please clinically correlate, but nobody reads that line. Everyone just goes by the verdict. So please remember what is written below. Please clinically correlate. It is written on every file, every test, right? So this is an important thing. I'll not go into depth of this. I'll just give you an example from recent times. Right before everyone was using CT scan, right? Now everyone is using. This is recent report in Hindustan Times where they said that patients with mild symptoms don't need CT scan again because they found out that minute changes on CT were not associated with significant COVID, pneumonia, and all those things. So similarly, this is applicable to us, our profession also. That sometimes what you see on an X-ray or an MRI is not the real picture of the patient. It's not the physical picture of the patient. We have to rely on our subjective examination, objective examination, and our physical symptoms of the patient. There are patients who had complete bulges, and Nitin may share some. He has seen few patients. I saw him yesterday posting vertigo case. Right? If you take them for an MRI, it will show so many things. The canal is filled, and this is filled, and that is filled. You know, sometimes that makes no sense. So please make sure that you don't over rely on those things. Simple exercises, simple advice, simple properly following the sequence will make things work wonderfully for your patient. So don't over rely on them. And at the end, I'll always say that, right? Don't overscan or don't overdiagnose your clients and patients. Sometimes the problem is very simple, very, very simple. Okay. The problem is too minute, just a sprain, and we complicated it. Oh God, let's do an MRI, let's do an X-ray. बाद में पता चला it's just a lumbar sprain, simple strain, or just an ankle sprain. Okay, that's fine. My voice is not clear. Nitin, I think. Okay, so this is again one study I want everyone to read, and this is very interesting. The reason being is it's a 20 years long study. So for example, नितिन और मुझे एक स्टडी में लिया जाए and हमको 20 years तक ऑब्जर्व किया गया, and they found that there are changes happening in the cervical spine, okay, but that are not related with any of our pain. It means that were not related with any of our symptoms. So this is not just 1 year 2 year study. Some people argue कि सर आपने एक टाइम स्टडी करी और कैसे कैसे बोल दिया. So this is not like that. This is a very huge population based study, and this is an Asian based study. This is done in Japan. So it's not a foreign study. It's an Asian based study and a 20-year longitudinal study. Okay, so they took age just like my age, Nitin age, your age patients, right? Then okay, and they followed it up for very very long. Okay, what if the X-ray or MRI shows significant changes but patient is not showing symptoms? What is it? Don't treat the patient. If the patient is having no complaint at all, he does not require a treatment. Okay, the changes on the should be the changes on the MRI and the X-ray is non-significant at that moment, and it is possible. Okay, so I think a lot of points are clear. Test use करें, but with attentiveness. We are not saying we will not use it. Sometimes they are very useful. Acute injury है, fracture injury है, suspecting an concurrent fracture. I'm not saying don't use it. Use it, but with attention, with caution, relating with the patient. Don't just use it randomly. कोई भी आया MRI करा लो. अब आते हैं हमारे स्पेशल टेस्ट, है ना, फाइनली. ठीक है. um, जब भी आप कोई स्पेशल टेस्ट करो, please make sure you answer these three questions. First question is, what is the differential diagnosis? If you're doing a test to differentially diagnose, then it is justified. If you're just randomly doing any test, it is absurd. Don't do it. Please don't do it. It makes no sense. So if you're doing it for differentially diagnosing, do it. Otherwise, don't do it. Next is, okay, why I'm considering the test. Why I'm doing this test. Do I know why I'm doing this test? So I took history, I took subjective examination, I took objective examination, and then finally I came that okay, this is looking like a ACLT. So the second question answer is there. Yes, I know why I'm doing this test. I know that I'm suspecting something. The test makes sense, right? But the patient is showing no symptoms. There's no sign of ACL tear, but still I'm pulling out. I'm doing ACL tear test. Does it make sense? It makes no sense. So don't do it. Third question you need to answer is, how will doing the test change the management of my patient? Okay, क्या ये टेस्ट करने से any change आएगा? अगर नहीं आएगा, please don't avoid the test. So please use special tests with caution. Again, don't overuse them. Use them. I'm not saying don't use them, don't learn them. Learn them, but please use them with utmost attention. Now evaluation. किसी ने पहले ही बोला था evaluation और examination में वो पता होना चाहिए, हमें difference पता होना चाहिए. So evaluation और examination में सबसे बड़ा difference है. Sorry. Evaluation और examination में सबसे बड़ा difference है. Evaluation is the clinical reasoning process. ठीक है. Examination जो है that's just collection of data. ठीक है, समझ में आया? Examination is we are collecting data, Evaluation is we are making sense of that data. Or I'm a researcher, so I'm saying data. Actually, we should say patient information. So is it fine? So if your data or if your patient information is what it does it say? Now here is where you will come to know whether you need to refer your patient, whether you need to go for something, or does he require surgery, or is it my patient. So here it will be that this is a pure physiotherapy patient. I can manage it, and within this many days it will get better. Okay, so this is the difference between the examination and evaluation. Many students don't know this, and it is very important to know the difference between the two. Don't all evaluation is making clinical reason, thinking in your brain what is out there, what is the problem out there. Okay, I hope this is also clear to everyone. I'm assuming, okay, because it's virtual, I cannot see. Okay, I'm a second year student of second year. I have one question: if a patient's bulging fluid comes out a little bit only, then we treat it with normal therapy or exercise. Depends on a lot of things, प्रदीप. um, बहुत सारी चीज़ों में depend करता है. Like what is the fluid? Is it infectious? Is it after fracture? Is it a normal just a pulp? बहुत सारी चीज़ों पे आपकी clinical reasoning depend करेगी whether you want to go for a normal exercise session or you want to refer it from for a referral. हाँ, यहाँ पे एक चीज़ रहेगी. जब आप evaluation करें, please make sure that you do red flag screening. I hope everyone knows red flag screening. Red flag screening basically means the patient is having serious symptoms which cannot be treated by physiotherapy, like cancer, TB, or maybe osteomyelitis or multiple joints. Okay, residual, or maybe even uh, आज के time में he's having an active COVID. These are red flags. We don't need to treat them at at once. We need to refer them. After the referral, we can see them. It's not like we will not see them, but maybe sometimes we need to refer them. For example, patient is telling, I'm losing my weight. 10 kgs I've lost within 3 days. It's a red flag. We need to refer this patient. This patient is having something sinister. So don't treat everyone. Please make sure that you screen for red flags. Okay, is that fine? So I think we can go ahead. Now finally सब कुछ कर लिया हमने. अब हम कहाँ पे आए? हम डायग्नोसिस पे आ गए. So now we have done history, examination, evaluation, red flag screening, right? We have done everything. And finally we have reached diagnosis. Huh? So now there's a big debate going on. I don't know how relevant it is here for the okay, how relevant it is for this group. यहाँ पे group में मतलब कितना relevant है कि नहीं. There's a lot of debate going on between non-specific versus specific. मैं एक simple चीज़ ये कहना चाहता हूँ. As a physio, try to assess functionally or try to assess the impairments. हमारे लिए for us structural diagnosis is not that important. For us, what is important is what are the patient's impairment. For example, we are not going to treat osteoarthritis, right? The cartilage degeneration will be there. We are not treating it. What we are treating is the associated symptoms. What we are curing is the problem, like quads weakness, okay, quads insufficiency, pain, okay, gait problems, weight bearing issues, sitting issues, okay, getting up from the chair issues. So different sorts of impairments which are present in the patient, that is what we are treating. Okay, is that fine? I hope that that point is clear. Sure. Okay, so always try for that things, these things whenever you're trying to assess. Low back pain again does not make any sense. For example, I'll give example. For example, me and Nitin are talking about a case, right? So how will I tell him? I'll tell him, say, I saw a patient who had a back pain, radiating pain, and he was still talking about numb and needle sensation. Now it makes sense to Nitin. I say just simply, उसको back pain था. Doesn't make any sense. कहाँ pain था? We don't know it. है ना? It was radiating, it was non-radiating, it was localized, it was non-localized. है ना? We are not surgeons. Simply cervical में pain था. We are physios. We deal with the whole problem, right? We assess it holistically. So the debate is always there, but I hope when you will start practicing, you will also understand these things, that it is very important, and we see the patient as a whole, and we try to understand this thing that we need functional diagnosis. We don't need structural diagnosis most of the time. Second thing is non-specific. बहुत आपने सुना होगा आजकल non-specific neck pain, non-specific low back pain. What does that mean is that there is no reason present there. Okay, there's no reason there. Okay, so I'll not go into detail of that, but I just want to introduce you to uh, WHO's diagnostic types. So WHO defines it as four different types जो आपको पता होना चाहिए. One is red flag, which is a total no-no. Don't touch it, don't see it. Distinct region specific disorder, right? For example, ACL sprain, ankle sprain. एक region है जहाँ पे specific problem है जो आप identify कर सकते हो. ठीक है? Neck pain with radiation, radiculopathy, specific problem which you can identify. Somatization is what we mean by non-specific. This means chronic pain, no cause. Fibromyalgia, for example, chronic fatigue syndrome, long COVID, where I don't know where the cause is, but still the patient is having a problem, right? This is known as somatization. And finally, is a new condition which WHO has introduced, that is known as chronic pain or conditions which are chronic. For example, rheumatoid arthritis, psoriatic arthritis. These arthritis are chronic. Ankylosing spondylitis. Okay, so I hope everyone got a basic idea. I'll just go fast through this because this is little advanced versions of diagnostic. If you want to go into much detail of this, you can read it on WHO's ICDH. Sorry, International Classification of Diseases. Finally is prognosis, and I think somebody asked me हम patient को कैसे बोल सकते हैं कि prognosis क्या है. This you can tell with your experience. No one can teach you this. Yes, you can read a lot of papers on that and come to know that's the only way, or with experience. With experience, you will learn okay, ankle sprain heals within this time. Or if you're new to the field, I would advise you to read papers. There are papers on prognosis about everything. I think whoever asked this question, you can search online, put it on online, ankle sprain, prognosis. You will get thousands of papers. You can select any paper and tell the patient, see, there has been a lot of research done on this, and this is what the literature says. I'm confident, and approximately most of the time, right, the patient will improve within that time frame. So this is how you can communicate. This is a very philosophical paper. If you want to read again, I'll just put it up there. But अगर आप पेशेंट आजकल पेशेंट्स आर वेरी एजुकेटेड, सो इफ यू टेल देम ना मैंने रिसर्च किया था और अब मैं आपको बता रहा हूँ प्रोग्नोसिस ये है, योर रैपो will shoot up, right? He will say, oh my god, my physio is like anything. So please research, tell them evidence based what is the problem, what is the how much time it is going to take. So I think मैं बहुत ज़्यादा बोल गया, तो मैं एक सिंपल आपको स्लाइड दिखाता हूँ जो कि बहुत सारे पेन को एक्सप्लेन कर सकता है. That is known as Poulter's rules of two. Twos means majority of the simple problems ना, जिनको हम बोलते हैं स्ट्रेन स्ट्रेन, रात में सोए सुबह पेन हो गया ना, कोई चीज उठाई पेन हो गया, simple problems, they usually result from these four problems. Either you did a movement which was too quick and you were not used to it, so you got a strain, stretched ligament or a muscle, or you did a too strong movement, right? For example, you were shifting houses, or you were not used to go to gym and you went and you did a heavy deadlift, gone, sprain, right? So that is too strong, too long. You're doing a particular movement or you're doing a particular repetition for longer duration, or you're doing it too often. So long duration and commonly repetitively if you're doing it, then can cause pain. So these are simple, these are not for very complex conditions, these are for simple strain and sprain. You can just think in your head, right? सिंपल थिंग्स है ना. क्यों हो गया स्प्रेन, क्यों हो गया, कभी क्रिकेट नहीं खेला था, कल खेला, now the shoulder is paining like anything because we did it too quick, too strong movements which we were not used to, we got the pain, right? That's an interesting. So finally, after the whole session, sit down and think in your head, have you really addressed your patient's concern? If you have, your patient will be 100% satisfied with you will be 100% satisfied, and everybody will be happy. The profession will bloom, we all will become highly successful. Now, intervention. I'll just go one slide and I'll stop. This is my favorite slide, and there's a lot debate on manual therapy. Karni hai, nahi karni hai. I am not in favor of neither doing it, not doing it. This is what I believe. So sometimes patient is having pain. You gave exercises. He's not able to go. His pain is not able. Matlab, he's not able to climb the mountain. He's in a pain hole. Where is the manual therapy? Manual therapy. This is the manual therapist. So he's helping it. So remember, exercise is the mainstay. Everything else is an adjunct. They are not treatment, right? For example, a patient came with cervical radiculopathy, radiating pain into the hand. Initial neural mobilization is an adjunct. Adjunct means it's a temporary relief. Long-term relief, if I need to change his behavior. I will need to change his movements. I need to strengthen his movements. I need exercise. And exercise is here to stay, believe it or not. Nowadays, we are seeing everywhere pulmonary rehab for COVID patients, exercises for COVID patients. Why? Because exercise is the best treatment a physio can give. No doubt the manual therapy is important, but exercise is furthermore important. Further than this, these are the things which we usually don't do, which I believe you should start doing. Be empathetic to the patient. Okay? Show some courtesy, talk, and give some empathy. Therapeutic alliance, okay, reframe beliefs and all those things. I don't want to go into this much depth, but this diagram basically ends the debate whether we should use one thing or not. Use something for shorter durations. Don't rely on them. Don't make your patients dependent on them, right? Like manual therapy only or electrotherapy only. You don't use electro, but maybe if you're using it, then but majority of the time try to rely on exercises, on your communication skills, okay, on your empathetic skills, okay, or your therapeutic alliance, all those things you need to basically focus on. So I think I'll end up here with a quote. This diagram I'll just avoid because it's too complicated, and I'll try to answer questions that is more important. I think we followed a systematic approach. This was on evidence based. We have just touched evidence based very briefly, right? But finally, always remember this thing. Don't try to put all patients under the same umbrella. The umbrella will never be big enough to keep everyone out of the rain. Remember this thing. Don't do the same treatment on everyone. Be a physio who's unique, and that's when the patient will come to you, right? Otherwise, no one is going to come to you. If you're going the same ultrasound again and again, patients will understand it's 21st century. They know everyone Googles it, right? Be evidence based, okay, as much as possible. So this is my approach of seeing patients. I have not touched on many things like evidence. I wanted to go into detail of philosophy of that. Considering the group, I've kept it as basic as possible, so it is useful for all of us. Right? We all see patients, and if at least we stick to this, right? I believe we will be able to see patients much better. And finally, this is my favorite quote, as I always say, you know, and I had a teacher in my internship, and I always quote at the end of every presentation. She told me one day she has been seeing stroke patients since her first MBBS year. Okay, I asked her, ma'am, how long it has been? She told me it's 40 years, 40 years experience. She told me I have never seen two stroke patients similar. Never. In 40 years, she has seen every impairment different. So remember this thing. Don't be individualistic. Read research as much as possible. You know, we all are always there. Nathan is there. We are there. And try to find a mentor, learn research, apply it. Okay, practice it. That's how we can progress. And please don't do things like quacks. Right? जो एक ट्रीटमेंट सबको देता है कोई भी पेशेंट आया मालिश करनी है ना, और प्लास्टर बांधना है बस। कुछ भी हो, एंकल स्प्रेन हो, बैक पेन हो, नेक पेन हो, नोज पेन हो, एक ही ट्रीटमेंट सबको, है ना। सो वी शुड नॉट डू लाइक दैट। वी आर साइंटिफिक कम्युनिटी, we should be very specific to our patients, what the problem is, what the solution is. Then of course we'll get a lot of success. So I think that's the end of this, and I hope everyone enjoyed it. If there are questions, we can answer that.
Well, I would say, sir, thank you so much. That was, I'm sorry for the echo. So I would say that was really informative. I mean, there was many things which I also was very happy to see it, because I tell my patients a lot of times that you had been doing these things from such a long time. That is what has been leading to this problem. But in actuality, this term, Poulter's law of twos, this was, I was unaware of that. So I would say that it was really good, and the participants also enjoyed a lot, I believe, and they learned something out of it, a lot of things. So I would open up the session for questions. So all of you, if you have any questions, any queries, you can just ping up in the chat so sir can answer you and help you out with that. So meanwhile, we'll take the previous questions which were left in the midst of the session.
Sure.
And so, sir, we have from Mr. Pradeep Sani. So it's on the screen.
Okay. Can we use dry and wet cupping? I don't use it. So again, it's in my personal opinion answer. You can say I'm a physiotherapist. I don't use any other adjuncts. You can use it. Now the problem in India is they are mixing it up with physiotherapy. That's the problem I have. And if you go abroad, it's a different technique altogether. You can do a licensing and you can sell your, say you are a cupper or you do cupping. So no problem in that, because after physiotherapy you can do anything. Nobody stops anyone, right? I do PhD in public health or someone is doing an MBA. No issues. But the problem in our country is nothing is regulated. So they're mixing it up with physiotherapy. That's my problem. Otherwise, you do it, you become licensed, you learn it, no problem. But it's not part of physiotherapy. That's the point.
So it's just like a physiotherapist clearing an IAS exam and become the DM. So that's not
Yes,
at all related to physiotherapy, but you can
yes,
practice that. I mean, you
you
can
can
become
practice.
that if you clear that thing,
Of course,
right?
no one is stopping anyone to practice it.
Yeah. And then we have the next question from Miss Gayatri Yashoda.
Okay. So I think she misunderstood the point, right? So I didn't said we cannot treat arthritis. We were talking about pathology inside. What we are basically treating is the patient's real problems, right? Means what is the main problem of the patient is pain and not able to do activities, not able to do swelling as you have written. That is what we are treating, right? With cryotherapy, with exercise, with manual therapy, maybe sometime taping, some people use brace, tissue modifications, whatever you're trying to do, but you're basically trying to reduce the pain, trying to reduce the swelling. So we are of course treating it. What we are not treating is the inside, right? I would say we can even treat that also, but for that we need a long-term management. For example, weight management, okay, or for example, a long-term exercise protocol which will reduce the load on the joint. So you can reduce that also, but इतना लंबा patients in Indian context नहीं आते हैं. We usually don't get patients for so long. Otherwise, weight reduction causes 10 kg weight reduction causes almost 2 to 3% weight reduction, load reduction on the joint. That's a huge load reduction. So you can of course treat it.
Yes, indeed, sir. Then we have, what's the next question? Yes. What can we do for post-COVID patients who have recovered but yet suffering from a bit of breathing problems and their reports are normal? Okay.
Breathing exercises, all sort of breathing exercises possible, thoracic expansion exercises, and if you're seeing them hands on, please try to incorporate some form of walking. And okay, like 6 minute walks, 2 minute walks, whatever their capacity is, but gradually. Don't push them because they have fatigue. I also got COVID and I recovered, so I know that there's a lot of fatigue. So I started exercises very gradually. Initially, I was just able to do 5-minute walks, not more than that. And SpO2 used to dip. So don't force them, but yes, if you're seeing them, you can progress them very easily, very effective.
Yes, indeed, sir. So, Rishabh, I would like to add on to sir's comments here. So, like sir very rightly mentioned in the whole session, that before treating them, you should actually analyze them, assess them, that
Yes.
what's the actual issue. So, once you assess them, you'll get to know whether they are having smell issues, breathing issues, whether they are having, mobility issues, or any other comorbidities along with the COVID problem. So if you assess them, you observe them, you then do the actual treatment, and then you can actually apply all the things which sir told, in terms of breathing exercises, spirometry, after doing all those movement tests, 6-minute walk test,
Exactly.
and the inspiratory testing. All right. So next question is, Ms. Purnima is asking, how do we manage pain in patient with fibromyalgia who has a constant complaint of pain? Okay.
That's a very tough question. It's very difficult to manage fibromyalgia patient. I don't say it's impossible, but yes, very dicey. In every patient, something different works. Majority of the patient aerobic exercises works, but you have to convince the patient to do it. It takes long time. Other than that, relaxation techniques do work. More than that, CBT, which is not our domain, has shown to work wonderfully. But for that, you need to refer it to a psychologist. But aerobic exercises, I have tried myself on few patients. They do work, but it's just we have to make the patient understand that you have to do it for long because it's a
For
very
long.
chronic problem. Yes. So the exercise also has to be very chronic. One simple example you can give to the patient is patient को लगता है कि मैं एक दिन में ठीक हो जाऊंगा तो आप उनसे बोल सकते हैं see your problem is there for 10 years now how can you treat it in one day it has to be a long process so that way you can convince them but aerobic works wonderfully.
बिकॉज जब भी वो पेशेंट आपके पास आएंगे बीइंग ए फिजिकल थेरेपिस्ट, वो मोस्ट ऑफ द टाइम ट्राई करके आएंगे, मेडिसिन भी ले चुके होंगे, सब कुछ कर चुके
Yes.
होंगे. जब तक दे विल बी टेकिंग
So in India they are
medications.
very late.
या
Yes.
so whenever they are taking
Exactly.
medications, they are like okay, they are feeling eased, and as soon as the medications are taken off, the pain starts again. So now they are irritated, they have lost their patience that why I'm not getting treated. I visit the best orthopedician,
Exactly.
best doctor, best rheumatologist, or any specialty for that purpose. But what's the main issue? So then the main education part comes into action. Then all the treatments comes into action. That it is a long-term process. It takes time to recover because it has been from long years back. So it's a
Exactly.
comprehensive, multi-dimensional rehab, as sir said. It's CBT, it's aerobic exercise, it's complete multidisciplinary team approach for chronic pain that will work for that patient. All right. So the next question is from Miss Close. I would say Close Langbang, and
Sometimes the patient disagree with the best feeling. Okay. Then we can't cure everyone, right? We can't change the behavior of everyone. So whatever is their wish, we can do that. It's our duty to tell them what is the best. If somebody doesn't agree, we cannot push them. Like sometimes we do counsel the patient, surgery is not the best option. Patient says no, मैंने करनी है. So क्या कर सकते हैं? You have to listen to them because it is their body, it is not our body. We cannot force them.
obviously, so being their physical therapist, we can just educate them in the best possible manner, and as soon as they are satisfied, they'll actually follow what you are trying to say. Because anyone, I mean, even in your friends, your society, you talk to someone, until unless they are not satisfied with your approach, they'll not follow you anyhow, be it a simple case of a mild pain or anything for that sake. So you need to be a good educator to be a good physical therapist, that would actually make the things easier
Yes.
in the longer run.
Yes. But in the end, we need to remember we cannot please everyone. Some of the
Yes, we
patients will
cannot please.
not.
So because and every individual is different and we can't change everyone's behavior.
True.
And what's the next one? What?
I think this is
Okay, I think
answered.
this has been answered. Yes, this has been answered. Yes, so I believe most of them have been done. Okay, no, I'm sorry. We have something at the end of it. some of my questions are not relevant to topic, but if you can help me with a little bit difficult questions, what are the different courses available in PT after BPT so we can get a job in every hospital?
God. I think Nitin will take one more session on this.
Yes, I would. I was just planning to make a complete video on what all you can do after BPT, what all
Yes, there should
specialties we have,
there
and
should be a
how.
video for that.
Yes. So I'll just make a quick video in the next maybe 5 days. I'll post a video for that, and you can go through it, and you'll get to know what all amenities do we have, what all opportunities do you have after BPT and MPT for that sake, so that all can get benefited. And Akshay is asking if the person gets breathing strokes while sleeping, what can be done?
Okay. Consult a physiotherapist as soon as possible because this is
All
sleep
right.
apnea. It needs to be treated as soon as possible. Please consult any good physio which is around you as soon as possible.
As
It
soon as
requires
possible.
hands-on treatment. It requires a lot of modifications. It's not good to have sleep apnea because sometimes it can choke you. It's very good. It's very essential to get treated as soon as possible. And physio has 100% success in this. There are a lot of physios working on this. Many cardiopulmonary physios you will get. Please consult as soon as possible.
That's indeed a good point. And I believe so. We are taking the last question for this session, and that is how can we differentially diagnose between tendinitis and bursitis?
Okay. Ten, Tendinopathy, I'll say, I'll not say tendinitis. Tendinopathy will be painful on resisted isometric testing. That is, if you load the tendon, it will cause pain. Bursitis will not do the same. Bursitis is usually painful on palpation or after repetitive movement when it gets irritated. Okay, so that's the base. That's how basically you can differentiate. Secondly, bursa refers causes radiating pain. Tendinopathy does not cause radiating pain. That's the basic difference. So if it is tendinopathy Achilles, it will be localized. If it's a bursa, it will radiate along the line of the muscle. So underneath which muscle it is, the bursa will cause pain all along the muscle. So that's the basic difference between bursitis and tendinopathy.
Well, I believe Vijay Lakshmi's doubt would be very much clear. These two topics, I mean, these 2 points are very much important in actually identifying the difference between the two. So, well, thank you so much, sir. It was really helpful, really informative, and thank you so much for coming on such short notice for our participants. And I believe they would actually be taking home a very beautiful message out of it, that what physiotherapists can actually do and how beautifully they can make a difference in people's lives.
Yes,
Because
exactly.
being a part of this noble profession, we are actually there to help out people in some way or the other. So this is something we have to work upon, and updating your knowledge and getting something out of the best people out there is the best approach we can follow, to make ourselves better, improve our education level, improve our understanding. Because ultimately, whenever you're gonna see a patient, you are actually gonna propagate what you have learned. So if you have learned good things, you will propagate that thing, and patient will be very much happy, very much satisfied with the approach. So thank you so much, sir, again.
Yeah. Thank you, Nitin, for the opportunity. It was nice.
All right, thank you so much, all of you, for joining. And all right, sir, take care. Good night.
Thank you, everyone.
Okay, cool. So now, as our speaker is gone and he has just given us a number of good concepts which can actually help us in improving our day to day practice. So I believe you would have liked it. And if you get any doubt, any confusion in any of the components which I told you or sir told you, you can just ping up in the comment section, and we'll surely be helping you out with that. And we'll try our best to get the best answer for you. Because I again would like to say, I always say the same thing. This time as well, I would say that being a human being, we can't know everything, but we would try to answer your question. We would search, we would read, we would learn, and we would help you learn as well. So, along with that, I would like to let you all know that today we have completed 5,000 subscribers. Thanks to you all. Thanks for your love, and thanks for your utmost, connection that you had made in the last 1 year. But with those 5,000 subscribers, I would say that I will not be, I will not be taking something out of it. I'll just be keeping the things the same. Was a free session. It will be a free session forever. Okay. And along with that, I would like to let all of you know that we are going to start an orthopedic course, orthopedic series, complete series on what all topics you have VPT second year and third year, including condition wise treatment, including special tests, including all the treatment aspects. So, all the orthopedic cases that you might have learned in second year, Aples, Maheshwari, Jayan Joshi, and n number of books, Netters, you know. So all those books, we have made a summary out of that, and we have made a complete video lectures out of that. So we are gonna start those lectures from tomorrow onwards. Tomorrow at 10 p.m. I'll just quickly check the comments. I think something is left, right? Okay. Since back pain has been one of the major complaints. All right. Yes, so Solanki Bhumika, yes, this video will be posted on YouTube on my channel. You can just share it to all of your friends, and I would urge all of you to share this with all the people you know so that they can actually learn what physiotherapy is. Because what happens is ultimately, being a physiotherapist, I always want that everyone should respect me, and I believe you also want the same. So for getting a respect out of the society should know, you know, that what physiotherapy is. Because all the time I have seen a thing. When I joined my bachelor's in 2013, I just, I was in my class. One of our professors asked, like, why have you people chosen physiotherapy? So I was like, I'm a physical therapist. I want to pursue physical therapy because it is somehow my family profession. Some of my family members are physical therapists. And second thing, it is something that you can actually get involved into. But at the same time, 80% of the responses were because we did not get entry into some other medical profession. So that is why we chose physiotherapy. So I would say, but at the same time, that was a very first year of physiotherapy for all those people. But as soon as they emerged out of it, after 5 years of studies for physiotherapy, they got to know that what physiotherapy is and how well they are actually making difference in people's lives. So because why I told you all this story, because I just read a question that how can we make people understand that what it is all about? I mean, how can we make changes in people's life? So we can actually help them out to get rid of all the problems they are facing, because until unless it's not a red flag, until unless it's not a very acute condition, we can help that patient out. So let's say in an MRI, X-ray, CT scan, it is shown that it is disc bulge, it is this, that, blah, 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 and number of things are there. So it is not always the consideration that you should not be worried about. Okay, MRI is saying disc bulge at L4, L5 level, indenting the thecal sac. So it is not something that you'll say, okay, I don't know anything. No, you have studied 5 years. You know that MRI findings are just for our help, not concluding the thing. They are just for helping us out that what we need to do. Once we assess the patient, we see the MRI afterwards, because we don't want to bias ourselves. Because if we see the doctor's report, the MRI findings on a prior hand, we may get biased. Okay, this patient, the MRI is showing disc bulge. Okay, let's treat him for disc bulge or her for disc bulge. But actually, there might be something called muscle strain, muscle sprain. Okay, so in that case, what we want is that we should treat the patient, not the MRI. MRI is just a picture. It helps us in our clinical diagnosis, but not a clinical diagnosis in itself. So they clearly mention, please correlate clinically. So whenever we see an MRI, we should be focused on what the patient has plus what the MRI adds on to that. So it's a complete comprehensive thing and not solely a diagnosis, the MRI thing. And likewise, when you'll get through all those orthopedic lectures which I'm talking about, so which we're going to start from tomorrow at 10 p.m. onwards, every alternate day we will be releasing one lecture, and that way we'll be completing 28 complete sessions. So completing your complete orthopedic series on, you know, all the topics which you have in orthopedics. So in those series, that's completely free of cost. We are not going to charge you anything. But what we want from you people is that you share that with your friends, with your known tools, with your colleagues, so that they can also learn. And our understanding, which we want to help people, we want to help people. So that can only be done if you share what we are trying to propagate, because when people will get to know good things, they'll propagate good things. So it's just sharing the things, and then more people will learn, more people will grow. So it's as simple as that. And in the process of learning, for today's lecture, for past lecture, all my lectures since the last 1 year are available on this YouTube channel. You can just go on the YouTube channel, you can search any physiotherapy technique and write my name, Nitin. Okay, PNF Nitin, palpation Nitin, mobilization Nitin, anything. You'll find a lecture on that. I used to take sessions, I mean, live classes as well for many of our students. So I would say if you get any doubt in any of the topic, you can just ping us at any time in the comment section, or maybe you have my numbers in the videos. You can just text me, you can just mail me. I'll help you out. I'll try to help you out in the best possible way. So, with these words, I would like to say thank you so much. Share the good words with all of your friends, with all of your relatives, so that they can also get to know the worth of physiotherapy and what and how you can actually bring the difference in people's lives. With that said, I bid you goodbye to say you hi again. Bye bye. See you. Take care.